Hello dear friends, today I will show you a very interesting case. It is a case of a missing abdominal abscess. This is a 66-year-old woman who presented and readmitted for severe left iliac fossa pain. The last CT scan 4 days ago showed left-sided hydronephrosis. There were increased inflammatory markers, and the query from the clinician was renal stone. And let's see the images. I will start from the upper poles of the kidneys. This is a CTKUB. So as we can see, there is a moderate hydronephrosis in this region comparing to the right. I will zoom in. Okay, so we agree that this is a moderate hydronephrosis on the left side. Now let's scroll down and let's see the images. Just pay attention on the left iliac fossa. Okay, so I don't want to take your time. Anyway, there is no evidence of renal stone, but what was missed in the previous CT scan is this. Let's discuss it. Let's analyze it. Probably the radiologist who reported the previous CT scan confused this finding, which is an abscess, with a large bowel loop, and indeed it's a little difficult to distinguish, but I will show you the way how not to miss a finding like this. First of all, I would like to remind you that our responsibility is to check the gastrointestinal tract as thoroughly as possible. So let's start from the anorectal region and let's track the large bowel first. Okay, here is the anorectal region. Just follow my arrow to help you. Here is the sigmoid colon. It goes up. Okay, here is the sigmoid colon. Again, back down and up, and here it goes and continues to the descending colon up here. Okay, let's go down again, and we can see that adjacent to the sigmoid colon there is a separate structure here. All this is an abscess. Okay, so let's go once again to see it again. This is the sigmoid colon, goes up, and there is something extraluminal here. All this. Another interesting finding is that if we compare the two psoas muscles here, we can see that the left one is swollen. If we go little down, we can see the difference. This is the right, this is the left. This is swollen. And underneath its fascia here, we can see some gas bubbles. So in this case, I would like to mention the two following things, that the only way to approach the correct diagnosis is to track the gastrointestinal tract, in this case the colon, as thoroughly as possible. And the second point is that In case we have hydronephrosis but no obvious calcified renal stone, we must search for an alternative obstructing cause. So in this case, the obstructing cause is this abscess. We can see here the left ureter. It is dilated, and now at this point it is collapsed due to the presence of the abscess. Now let's see the abscess on coronal views. Here it is. You can see the asymmetric swelling of the left psoas muscle here. And here is the left hydronephrosis. Dear friends, thank you for watching. If you find my videos interesting and useful, please drop a like and consider to subscribe so you will not miss my next interesting case in radiology. And of course, any questions or thoughts are welcome in the comments. Thanks for watching, and until next time.